We are joined next by Freddy Mejia, Policy Director at the Commonwealth Institute, an organization that works with leaders across Virginia to improve health care and make life more affordable for 8 million people who call Virginia their home. At the Commonwealth Institute, Freddy works with leaders to help remove barriers and red tape to Medicaid and ensure that more Virginians have access to the health care they need. Freddy, you are now recognized.
Thank you. Good morning, everyone. And thank you to the co-chair Barragan for the introduction. My name is Freddy Mejia, as you heard, and I'm the Policy Director at the Commonwealth Institute for Fiscal Analysis. It's a nonpartisan, research and advocacy-based nonprofit located in Richmond, Virginia. We all know that Medicaid is a critical safety net for millions of kids, adults, and older adults across the nation. What can sometimes be missed is the role that Medicaid plays in offering affordable and comprehensive health coverage to our military veterans and their families. Virginia is home to over 600,000 military veterans. The Commonwealth Institute estimates that Medicaid provides coverage for nearly 1 out of every 13 veterans in Virginia. That's roughly 47,000 people. We can safely assume that a large portion of this number lives not too far from here, in Norfolk and the Hampton Roads region in Virginia. These individuals may be adults working low-wage jobs, living with a disability, battling a long-term illness, caring for a loved one at home, or in between jobs, just like hundreds of thousands of individuals in Virginia who access coverage through Medicaid or Medicaid expansion. As we discuss the importance of policies and investments needed to ensure that our military veterans and their families have what they need to thrive, recent GOP legislative actions have threatened the Medicaid program through over $700 billion in funding cuts, as well as the erection of new barriers, new out-of-pocket costs, and additional paperwork for many veterans when applying and redetermining their health coverage through Medicaid. The big, beautiful bill, as some refer to it, although I heard a different name here earlier, it would require anyone who gets coverage through Medicaid expansion and earns above the federal poverty limit to pay up to $35 to access certain health services. There are no exclusions for this copayment for military veterans, and it could take up critical resources that would otherwise be put toward food or other basic needs. New work reporting requirements could deny coverage for veterans on Medicaid expansion unless they are able to complete and submit paperwork proving their employment or that they have a disability or caring for a child or a disabled adult. Finally, everyone on Medicaid expansion will be required to undergo eligibility checks every 6 months instead of once a year. That is twice the amount of paperwork and more opportunities for administrative issues to hinder the ability for people to keep their coverage. Again, there are no exclusions for this additional administrative burden for military veterans. I do not doubt that these new barriers to coverage will cause veterans who should be eligible for Medicaid coverage to be pushed out of the system and to end up uninsured. Thank you once again for the opportunity to speak with you. I encourage everyone in the audience, as well as listening today, to stay engaged and raise awareness about these threats to veteran health as the bill makes its way through the U.S. Senate. Thank you.